Hi, I'm Stephanie Stoddart, and I'm a member of the class of 2013 here at the University of Connecticut School of Dental Medicine. It was kind of a rush. You went in, you didn't know actually what you were doing, but you kind of figured it out along the way. The first patient that I met I had to take an impression for that patient and didn't know what I was really doing, but kind of figured it out along the way, and that's pretty much what it's like on a day-to-day basis until you get sort of comfortable with how things operate here. You do have the choice of making your own schedule, which I do like. So patients are assigned to you and you call them and see what's available and schedule them according to your own availability. Yeah, like I said, it was kind of crazy coming in. You didn't know what you were doing. I mean, for the first 2 years, we were learning about kidneys and feet and heart and lung, and you didn't know how it really applied to the oral cavity itself. But then you kind of figured it out along the way that systemic diseases such as hypertension and diabetes, that they're related to dental care. And just meeting the patients with these conditions, we had to explain to them how taking care of their teeth could affect their overall health and vice versa. So that was really cool in the sense that we got to be educators, and we were also being educated on how to treat patients when they came in. Let's see. Especially, I think it was more nerve-wracking for me when I started to do restorative procedures, to say getting a fill-in. You practiced for the first 2 years on fake teeth downstairs, and that was great. But here it was like a real tooth, so you couldn't really mess up. You had the option downstairs of changing the teeth. Back here, that wasn't the case. If you messed up, you kind of had to figure out how to fix it on the spot and not freak out. So I think that's why they make us wear masks. That way our patients don't know that we're actually screaming inside and saying, I can't believe I'm doing this, I can't believe I'm doing this, but kind of try to compose yourself beneath the mask and just take a deep breath and kind of explain to them what happened if something went wrong and how to fix it. Yeah, first year, I can't believe it's been a year. I've gotten definitely better with talking to my patients and just breaking things down from the scientific level and saying, okay, this is not a amalgam filling, you say the silver stuff, so that we can relate to them and that they can understand what's going on for them and how best to take care of the things that you do for them. In terms of you get to learn so much more than what you would have done downstairs. I mean, downstairs did provide a foundation for allowing us to feel a bit more comfortable when coming upstairs and working with the patients, but ultimately it had to deal with kind of faking it. You kind of have to fake it. You don't know what you're doing, you're pushed into a situation, but you faked it until you actually made it. So from the fake tooth, the typodonts, or many patients from downstairs, to say I was coming in to do a fill-in on the biting surface of the tooth, and I hadn't done it since first year. I'm not going to go to the patient and just practice on the patient. So I'd go downstairs in the preclinical all access lab and I'd practice on the tooth that I was working on for the next day. So a lot of clinic is about preparation, going through your patient's charts and seeing what they need, analyzing the x-rays and saying, okay, fine, if this were to go wrong, how would I correct it? So for me, that's what I did before seeing a patient until I got more comfortable with doing that procedure. So just kind of used it back and forth because, you had the option downstairs of changing the tooth. You don't have that when you start working with a patient. So I kind of had to say, okay, fine, at least maybe if I mess up downstairs, it's not a big deal. I can change a tooth. But if I messed up in the patient's mouth, it would have been a much bigger deal. Well, a little bit about myself. Before coming to dental school, I was actually in a Master's of Science program at Boston University, pursuing a degree in engineering. So I think for me, that gave me an advantage in the sense that I had to work before coming here. I had an 8 to 5 job, or actually a 7 a.m. to 7 p.m. job because I was a little bit of a lab rat. So I think that discipline that I had before, it helped me to translate that same discipline towards dentistry. Because the first 2 years, they weren't easy. They definitely weren't easy. I think for me, it helped that I was a little bit more structured. I liked studying in the mornings, coming to class, reviewing that same information in the afternoon. And on days when we didn't have dental classes, that worked. But when we had dental classes, it kind of, pushed your schedule a little bit later than what you usually are accustomed to. So for me, just being a little bit more organized and structured helped me a whole lot. And just knowing that, I got chosen for a reason. I'm paying my tuition to come here. I'm going to make the most of it. And that's pretty much what got me through it. Also for me too, I like being more balanced. So definitely hanging out with your friends and family and having something to do like yoga. For me it was yoga, or, painting. Just being involved outside of school, that helps you to realize, okay, fine, I can't spend 20,000 hours studying the same thing over and over. I do need to get a little outlet, and that's definitely helpful. You definitely need that. The DATs, like I said, at a time when I did choose to go into dentistry as a career. So a little bit about me again. Research assistant at my old school. So I had to balance going in, working, and studying for it. So I knew the PAT section was going to be more challenging for me, just because it is. Everything else is going to be fine. So for me, I got the crack the DAT or crack the PAT, got used to seeing it on a computerized form, so that when I went in to take the exam, it wasn't going to be a shell shocker for me. Okay. So I studied for it a couple of times a day, and then on Saturdays, to mimic the exam conditions, I would take it the same time as my scheduled DAT exam. That way I know when my stomach is going to rumble somewhere. I know exactly how to train myself for it. I didn't do a Kaplan class or any of those, what do you call those things? Standardized test taking companies. No, I didn't do any of that because I'm poor. And I figured I didn't have the time to invest in that as well, and I'm very much so dedicated towards my education, so I just put everything that I had for it. So I'm saying, if you're a science major right now, just take advantage of the science classes that you have right now. Make sure you study really hard for them, get your A's, A minuses, B pluses are okay, and just learn as much as you can in those classes, so that when you're preparing for the exam, it's not like, oh, what was that? You actually do refresh. So I think a month is a good time to study for it. Probably a couple times a day or a couple hours a day for the week should be good, and just simulating taking the exam under exam conditions when you do have a time. So yeah. What I really like about dentistry is my patient interactions. I get to meet patients from all walks of life. Just having them come in their chair, everyone has a story, and I'm always willing to hear it. Sometimes to my own, sometimes just to my own, to my own fault, just because I would just want to hear how was their day, how many kids they have, and then sometimes I don't have enough time to do my procedure, but that's okay. I'm working on talking a little less, but still learning a lot more about them. Yeah, just the different aspects of life that do enter your chair, and just having to know how to deal with every type of personality. It's a challenge, but it's really fun and really rewarding. So yeah. Question is kind of hard for me to answer, just because I haven't been exposed to as many areas of dentistry equally. So right now I'm more inclined to say I like when I deliver my dentures to my patients, only because I've done 20,000 of them. But I think for me, overall, I could say instantaneous results is what you get. So say you place a beautiful filling and the patient says, wow, I'm really happy that I didn't even know I have a filling there, because it just matches everything so closely. That's really gratifying for me. So for me, more of the aesthetic aspects of it, you can create, just lasting smiles, and just heartfelt emotions, just because you were able to fix something and make it as pretty as you wanted it to. So